Well, hello guys. Thanks for joining me. It's been a wonderful 5 days already. Self quarantine. Yeah, not the best 5 days. Trust me. But I'm getting there. Getting my energy back. Things are clearing up. I'm feeling a whole lot better than I did some 2, 3 days ago. Yeah, I'm just gonna try to adjust my camera a little bit so you can see me properly. All right, this looks better. Okay. Yeah, thanks for joining me. I will be talking to us today about infertility among couples, people who've been trying to get pregnant, married people, or just people in a relationship and trying to get pregnant and it just never happened. Now, before I continue, I have a YouTube channel. I want you to go look me up, Edith Declan. Please subscribe. Invite your friends to watch the video. Invite your friends to subscribe and watch the video. Share as much as you can. I hope that this message goes out to people who really need it. To you and to all those who really need it. And to those of you who have sent me suggestions about topics for discussion, thank you so much. I really appreciate it, and I will definitely ensure that I address those topics as we go on in the program. So thank you so much for joining me. I will be talking a little bit about infertility among couples, married people, single people, whoever. If you're in a relationship and you're trying to get pregnant, or you're trying to work with your spouse, towards getting pregnant. So this is for you. And if you know anybody that has any need for infertility education, please do not hesitate to send this message across to them. Share as much as you like, tag as many people as you like. Thank you so much, Mr. Nazoto, for joining me. Thank you so much. I know I probably sound like I sound like a horse right now, but yeah, I'm recuperating. I'm getting better, and I am very optimistic that in the next couple of days I will be a whole lot better than right now. So now, infertility. What is infertility? Infertility is pretty much when a couple are trying to get pregnant and they're not getting pregnant. Now, when I say they, I mean I'm talking about the man and the woman. So a woman does not get pregnant by herself. A man does not just get himself pregnant. So when I say they, it's a joint effort. So when two people are coming together and they're not getting pregnant, then we have a case of infertility. Now, there are two types of infertility that I want you to know. So, just in case you're having these issues and you're wondering where you lie, in this box. So, there is the primary infertility, and then there's a secondary infertility. The primary infertility is when a woman has never been pregnant at all, never been pregnant. Yes, that's primary. It could be as a result of so many things, and there's a secondary, which means that she probably has gotten pregnant before, maybe had a miscarriage, and now is not able to get pregnant again. So that is secondary infertility. All right. So I'm sorry. I'm gonna be clearing my throat every now and again because I'm in quarantine. It's self quarantine, and I'm trying to get better. I was actually almost not gonna do this today because I still haven't had enough energy in the last few days, but I am very optimistic that in the next couple of days I will at least a 50% energy level. Yeah. So after 1 year, a couple been trying to get pregnant and they're not getting pregnant at all. They've never been pregnant. Then yes, that is primary infertility. Now, a secondary infertility is when they have been pregnant before and it just wouldn't happen again. All right. So female infertility. We'll talk about a woman now. How does a woman determine that she is infertile? So it could be as a result of so many things. It could be that she's not even producing eggs. It could be she's not ovulating. So sometimes certain people do not ovulate. Some people don't even have periods. It's called amenorrhea. Yeah. So when people do not have periods, there is a high chance that they're not even ovulating. So if a woman is not ovulating, there's almost an impossible probability or chance that she would get pregnant. Now, if the woman is producing ovaries, for instance, thank you so much, Jane. Thank you so much. If a woman is producing eggs, if she's producing eggs from her ovaries, but then the ovaries are having a problem going from traveling through the fallopian tube into the uterus, then the woman is going to be infertile, right? Now, if the eggs are produced, but again, they probably they meet a male sperm and then they don't make it to the uterus for implantation, then the eggs are never gonna mature into a baby, right? Then she could also be referred to as being infertile. Now, if a fertilized egg or embryo does not survive, so after the male sperm and the female ovum meet together and it travels through the fallopian tube into the uterus, and it's supposed to actually implant in the uterus, but now for whatever reason the fertilized egg is not able to attach to the uterus or to the womb, then the woman can also be regarded as infertile, because of course there is no growth going on in the uterus. Now, there are so many reasons why a woman, thank you so much, Grace. I am definitely getting better. I was worse than this on Monday, Tuesday, and Wednesday. I am definitely getting better today, and I'm so happy. When I actually put on my makeup, I looked so good, and as you can see, I am so excited. I didn't know I could look like this. Yeah, but I'm so happy that I look better, and I'm so happy that I gave this a thought, because I was almost gonna just postpone this program for today because I wasn't feeling good, but I'm so glad I made up my mind to do it, and I feel great right now. All right, so there are so many causes of infertility. The first could be an autoimmune disorder, such as aminophospholipid syndrome. There are so many other disorders in the woman, such as Turner syndrome. Some women, even at 14 years old or 15 and 16, they're not having, secondary characteristics, or they're not even having periods at 16 and 17. Then definitely that woman is going to be having primary infertility. The other causes of infertility could be some birth defects. That a woman is born with a vagina does not necessarily mean that she's going to be ovulating and having a period. There could be some physiological defects that she might be having that could be responsible for loss of production of the eggs, or loss of inability of for the eggs to travel, or the inability for the eggs to implant, or for the it could be a whole bunch of physiological factors that could contribute to that. The next is clotting disorders. Yeah, so if a woman is having issues with clotting, think about it. Now, for the period, she is losing blood. When the eggs form, the baby forms through blood and all of that stuff. So if a woman is having any kind of clotting disorder, it's going to definitely affect the formation of the embryo. The next I want to talk about is diabetes. Diabetes plays a huge role in infertility. So a woman who has diabetes, for instance, who has problem with insulin production and usage, is definitely going to have issues with conception. So if you're trying to get pregnant and you're diabetic, you might actually want to go check that out. Drinking too much alcohol, smoking, too much exercise can contribute to infertility. Eating disorders, if you're not eating the right food, poor nutrition can contribute to infertility. Hormonal imbalances, medications such as chemotherapy, drugs can cause infertility. And of course, older age. As a woman grows older, the number of eggs that she produces begin to decline, and then she begins to get infertile. Some other things like ovarian cysts. So if she's having some cysts in her ovaries, and it's preventing the ovaries from releasing the eggs when it's supposed to, then yes, she's going to be infertile. Now, if she has other tumors or growths in her uterus that will prevent any kind of implantation of the eggs in the uterus, then she's going to be infertile. Smoking, I think I already said that. Then one area that I really want to talk about, and definitely in the long run we'll talk about communication. After surgery, let's say a woman had a couple of DNCs, for instance, or the curettage to take out the baby from, maybe some kind of abortion or something. That will definitely affect the lining of the uterus. So the depending on the number of surgical procedures that have ever happened in the uterus, those might also affect implantation. So it is something that you need to talk to your spouse about. It's nothing to be ashamed of. If you've had surgery, if you've had any kind of pelvic inflammatory disease, any kind of sexually transmitted disease, especially PIDs, pelvic inflammatory diseases, and gonorrhea, if you've had syphilis and trichomoniasis, anything that affects the consistency or the environment in the uterus or in the cervix, definitely would affect your chance of getting pregnant. So it's something you want to talk to your spouse or whoever you're trying to get pregnant with at that particular time. Also, thyroid diseases. I mean, yeah, I know a lot of people don't really pay attention to that, but in practice, I've always seen that when a woman comes into the hospital, we want to first of all check for thyroid problems. Some people have low thyroid production, which actually slows down everything. So if the thyroids are not functioning well, then there's a chance that the hormones that are responsible for the normal cycle, menstruation, ovulation, menstruation, and all of that stuff would definitely be out of balance. All right, so I talked about cancer and any kind of tumors that the woman might have. So for the man, it's not only the woman, and that's why I had started up this whole talk with communication. It's very important that if you both are trying to get pregnant, then it is not a one person thing. Both of you have to be on the same page, because what happens if the man is not physiologically ready, or if a man is not physiologically in a good position to get the woman pregnant, then conception is not going to take place. So it's very important that both of you, if you're trying to get pregnant, both of you are on the same page. You communicate openly, honestly, effectively, continuously, and that will actually help the process. Now, for the men, infertility could be as a result of decreased sperm production. Now, some people do not produce enough sperm, and of course, we know how the sperm, millions of the sperm are supposed to swim and then make it to the ovum, and then one is going to fertilize, and then the rest of them die. So if the man is not producing enough sperm, there is a tendency that nothing is going to get to the ovum, right? And then also we have physiological conditions that could also cause either no sperm production. So some people do not produce sperm at all. So I mean, you might be surprised, but yeah, that's a probability. And then some people have blockages. Some people might have had something called a vasectomy. So, but there are people who have physiological kind of vasectomy. So, like for whatever reason, there is no communication between sperm production and sperm release. Right? There's a blockage somewhere. Then it interferes with the ability for the sperm to be released into the woman. So if that happens, if a man, I mean, he might be a very healthy man, looking wonderful, producing sperm, but then the sperm is not coming out, to where it's supposed to be, then yes, they're going to have problems with fertility. Now, finally, a man might have defective sperm. If a man is, he drinks a lot, if a man drinks, heavily, smokes heavily, or is taking some kind of medication that could actually affect the quality of the sperm, then yes, they're going to have problems with conception. All right, so certain things can cause male infertility, and I'm going to just run through that in just a little bit. But of course, I want you to know that regardless of what the situation is, there is always going to be a way out, okay? So cancer treatments, including chemotherapy and radiation, can cause infertility and low sperm production. Exposure to high levels of heat for a long time can actually affect both the quality of the sperm and affect the environment in which the sperm is produced. So as a man, it's always advised that you wear underwear that are not too tight and not too hot. Don't try to restrict yourself way too much. Okay. Now, heavy use of alcohol, marijuana, cocaine, any kind of drug, it could even be over the counter drug. Any kind of misuse of drugs can affect sperm production. Hormone imbalance. So, testosterone, for instance, testosterone is, of course, we know it's the male hormone. Now, in some men, there is just a very low production of testosterone. So, that ultimately affects the production of sperm, it affects the sexual performance and all of that stuff. Impotence, inability for a man to start and maintain erection can also affect his fertility levels. Infection, any kind of infection that goes into the sperm or into the scrotum or the penis. It could even be like a UTI. It could be anything. It could be gonorrhea. An untreated gonorrhea can actually cause what do you call it? It can cause infertility. An untreated syphilis can cause infertility. So if you are a young man or whatever out there, and just try to, as much as possible, think about these things before you engage yourself in practices that might cost you a lot in the future. Also, medications such as potassium sparing diuretic, the spironolactone, and nitrofurantoin can actually cause infertility. Obesity, older age, retrograde ejaculation, scarring from STD. So even if you've had the STD like 20 years ago and it caused some damage, it caused some scarring, of course, they could actually affect fertility. Smoking, toxins in the environment can cause infertility, and a vasectomy. So if you're a man and you're trying to you get married and you didn't tell your wife that you had a vasectomy, then yes, you're going to be infertile. Okay, so if you ever had a vasectomy, there could actually be a reversal. But of course, like I said, open communication, honesty will help. It will go a long way. All right. So healthy couples under the age of 30 who have sex regularly, about 20% per month, have a chance of getting pregnant. Okay. A woman is most fertile in her 20s. That's a given. A woman is most fertile in her 20s. We all know that as a woman grows older, then her egg production, I don't want to call them eggs, but that's what it is. Her ovaries begin to produce less eggs, right? So usually from 20 years and above is a very good time if you want to be pregnant, if you know you want to have kids. Then from 35, if everything begins to kind of decline by 35, and then 40, and then she gets into menopause towards 50 and all of that. So infertility problems and miscarriages can increase significantly as the woman approaches 35. Now, are there women that have had kids in their 50s? Absolutely. There is no nothing is absolute and nothing is guaranteed. But of course, if you want to have kids, you don't want to take chances. All right. So there are now options. I'm going to talk about options for for infertile couples. So if you are in your 20s and then you're almost 30, you're thinking about, okay, you don't want to be pregnant now. Yes, you can have your eggs stored. You don't have to wait until you're 50 when you meet Mr. Right to have kids, and then at that point you probably can't find the eggs that you need to have the babies. So you can actually get the eggs and store them, because of course you have more and more eggs in your 20s and then the early 30s, and they're even healthier. Okay. Now, this will also ensure that you have a successful pregnancy or egg production after you turn 35. Now, it's expensive. I'm not going to lie to you. It's an expensive route, but for those people who have actually tried it, it kind of worked for them and they're really happy. Now, women who know they need to, this is for those who really want to delay childbearing. If you're ready to get married and have kids, please just go ahead and do that. Okay. So how do you test for infertility? There are exams and tests and a whole bunch of things that you need to do if you as a couple have tried for the last 1 year and you're not getting pregnant. Now, I am gonna say this, I'm gonna say this, and I did this. Back in the days. If you're having problems with infertility, I'm sorry to say that you need to go see a doctor, okay? You need to go figure out what's going on. It's okay to pray, it's okay to, to be spiritual and all of that, but if you're really serious about it, you need to go figure out what's going on, okay? You need to go see a doctor, you need to go run some tests, you need to go do some diagnostic workup, because it could be something that you need to fix really quick, okay? And then the more you delay, then the worse things get, and then the lesser the chance of getting results. So if you're trying to get pregnant, the first thing you want to do is, get to know your body and then go see a doctor. Okay, so deciding when to get pregnant depends on your age. But again, like I said, if you're not 35 yet, please try to do that as soon as possible. Healthcare providers suggest that women who are less than 30 try to get pregnant on their own for 1 year. So if you're 30 years and less and under, try to get pregnant for 1 year. So monitor your periods, the first day of your period is the first day of your cycle. Then 10 to 14 days after is your ovulation. And then, you try to have sex with your partner 2 days before, during ovulation, and then 2 days after. So, when you try that for a whole year and you're not successful, then yes, you want to go see a doctor. Now, if you're 35 years and above, you don't have to do that for 1 year. You probably, the time is short, so you want to do that for 6 months. If you've tried for 6 months and it's not working, then yes, you need to go see your doctor. Okay, infertility testing involves a lot of medical history, and that's why I talked about, your history of STDs, your history of surgeries, when you first had your menstrual cycle, how many partners you've had in the past, if you've ever been pregnant or not, because if you've been pregnant or not, if you've ever been pregnant, then that takes out some of the, some of the physiological causes of infertility, or primary causes of infertility. Now, if someone has never been pregnant before, then it means that something is not right completely, okay? But if someone has been pregnant before, it means that, okay, you were fine up until a point, right? Okay, so that helps with the treatment process. It's very important to discuss this with your doctor. So when they ask you, ever been pregnant before, don't just say no or yes, whatever. Be very factual, because that helps with the treatment process. All right, so they're gonna do some blood work. They're gonna check for blood levels, for anemia, for follicle stimulating hormones. They're gonna check your LH and all of those other labs. They're going to check thyroid function primarily, because if the problem is from the thyroid, then it's a very easy thing. They give you some supplements or whatever to help you build some, to augment your thyroid hormones, and then that can actually help you get pregnant. Now, some other things such as urine tests, you can do a home urine test. You can buy the pregnancy test kit and the ovulation indicators. So that helps you know your most fertile period, and then you can actually have sex with your partner around that time. Some other tests include a pelvic ultrasound, a transvaginal ultrasound. There's something called a laparoscopy. There's something called a HSG. I heard it's a little painful, a little uncomfortable, but then what happens is they go in through your vagina and then look in to see the ovaries, the fallopian tube. It just gives a clearer picture, of the whole female reproductive system. Now, for the men need to be tested also. So don't just assume that, okay, as a man, because you got XYZ pregnant 20 years ago, then Miss G is going to be pregnant. No. Sometimes, things happen, sperm production declines with age, like we said, infection, long-standing infection, untreated infection, scarring, sometimes emotional imbalance can actually cause a reduction in sperm production. So don't assume that, okay, because your last girlfriend, was pregnant 100 times, then your wife if your wife is not getting pregnant, then it's her fault. Heck no, that's not true. So if you're trying to work with your spouse today and they're not getting pregnant, then you need to be tested also. So you want to go for a sperm analysis. It tells the how viable the sperm is, how motile the sperm is, how healthy the sperm is. So even at that point, it's still possible for you to do a sperm what do you call it, sperm. You can save your sperm. Okay, you can actually harvest some of the sperm and then save them just in case you need them in the future. All right, so they're also going to test your penis. They're going to check and your testes, your scrotum. They're going to check, do some urine tests. They're going to do some ultrasound because there are physiological abnormalities that could actually impede the production of sperm. Now they're also going to do blood tests, like I said, check your thyroid and all of that. And then in some cases, if they're suspicious of any kind of growth, a tumor that could be interfering with sperm production or sperm delivery, I call it sperm production and delivery, they might want to do a biopsy of the lesion. All right. So the treatment depends on the course of the infertility. So if it's a primary infertility where there is a totally like nothing has ever happened, then yes, the treatment will definitely be channeled towards that. Now, if it's secondary, and in some people, I know about cases where the problem is that the woman is she gets pregnant every now and again, but then when the fetus begins to grow, it drops because the cervix is very, very incompetent. So in cases like that, there are solutions to preventing that from happening. So depending on the cause of infertility, if it's a male factor, he could be helped with some sperm boosters, some hormones to help boost the sperm production. If it's something that needs a surgical repair, it can be repaired. If it's depending on what it is. Now, if the woman is having, maybe diabetes or cysts in the ovaries, the cysts can be addressed and the ovaries will be able to produce healthy eggs, right? And then if the problem is in the fallopian tube or in the uterus preventing implantation, then that can also be addressed. So it's very important. Your history is very, very important. You need to discuss this with your healthcare provider so they know exactly how and where, how to channel the treatment plan and at what point they would meet you. All right. So if push comes to shove, and not just push comes to shove, I've seen people who have opted for IVF. They have opted for in vitro infertilization. It's just an assisted form of fertilization. So yeah, if that's the option, if that's what you want to do, please go ahead and do that. There are also medications to help treat infections that could be causing any kind of damages to the environment in the uterus or with the sperm production. There are medications, tons of medications to help. If the woman is having problems with production of eggs or ovulating, lots of medications can help her, ovulate and produce the much needed amount of eggs. Thank you, Dr. Kenneth Iwoji. You are so welcome. Thank you for joining me. I want to say a big thank you to Dr. Kenneth. He's been the one crossing my T's and dotting my I's. So every single time I'm out here talking to you, he goes back and watches it, and he would not just give me a breathing space because he wants me to keep doing the best and giving you all the best information. Thank you so much. Thank you, Nicole. Thank you so much for joining me. Thank you for your support. I really appreciate it. All right, so next I want to talk about couples increasing the chance of getting pregnant. Try to have sex as much as possible, okay? You can't have sex once in a month, and yes, sometimes, yes, it might happen. I've seen people get pregnant without even blinking, right? But yeah, sometimes when you get married or you're planning, the anxiety, the expectations, everything kind of builds up, so it kind of even reduces the chances of anything happening. So try to, as much as possible, have sex, as many times as you can. And if you are on birth control, you need to discuss that with your spouse. You cannot be on birth control and expect to be pregnant at the same time, right? Okay. Ovulation, like I said, it occurs 2 weeks before the next menstrual period starts, so about 14 days, 10 to 14 days. So if you want to get pregnant, try to have sex at least 2 days between the 10th and the 18th day after your period starts. So have sex before ovulation, of course. Okay, so that way the eggs can actually stay for a couple of days before they die off, and then they can actually what do you call it, fertilize the eggs. Now the sperm can live for at least 2 days. So if you're trying to get pregnant, try to do that way before. Don't do that like 5 days or 10 days after ovulating. Now, a woman's egg can only be fertilized by the sperm within 12 to 14 hours after it's released. It's very important for you to know that. Women who are under or overweight may increase their chances of becoming pregnant by getting a little healthier weight. So if you're really, really overweight, if you can work on your weight, that would actually help, help speed things up with getting pregnant. Prevent STIs such as gonorrhea, syphilis, chlamydia, because this, especially gonorrhea and chlamydia, have been known to increase the risk of infertility. Maintain a healthy diet, a healthy weight and lifestyle, and this can also increase your chance of getting pregnant. Avoid the use of lubricants during sex because it could affect some lubricants will definitely affect the quality of the sperm. Okay. Now, finally, I'm going to leave this here. I want you to be very open with your partner or to your partner. It's not something to be ashamed of. Both of you are in it together. You are in it together. It's not a male factor, neither is it a female factor. Both of you have to come together to figure out what the problem is, and then begin to work towards getting a solution together. You cannot try to be pregnant, or you cannot, be trying to get pregnant without your husband. If you're a woman, you can't be pregnant without getting your husband on the same page. And if you're a man, it's not a woman's responsibility to just be pregnant. You might be surprised that, things are not working right from your end. So it's something that both of you have to openly communicate about. There is no shame in it. Do not be judgmental. Do not try to make one party feel bad. It doesn't matter if you've had kids before. You might be having issues with repeating those right now. So it's something that everyone needs to be on the same page. Thank you so much, Nicole. Thank you so much. Thank you. I really appreciate your feedbacks. Thank you so much. Yeah. And what else was I gonna say? I will talk a little bit about erectile dysfunctions and some other problems that could, people who are trying to get pregnant encounter, but that will be subsequently. Thank you all so much for watching this program. I really do appreciate you. Do not forget, I have a YouTube channel. Yeah, I have a YouTube channel, and you can go watch my previous videos, and I'm going to be posting this over there. I also, what else was I gonna say? I'm gonna be doing this a whole lot more. Thank you. I have not been feeling so well, but I'm sorry. I was almost choking. Yeah, so I don't know, what else was I gonna say? I forgot. But anyway, it's been a pleasure talking to you all. I hope every one of us has learned 1 or 2 new things today, and I will continue to do this. I will continue to. Yes, I have a YouTube channel. Yes, it's Edith Declan. Just yeah, go ahead, subscribe, like the videos, share the videos, whatever you want to do with it. It's out there. It's for your consumption, and I would be very, very glad. All right. Thank you all for watching. Thank you for joining me. I look forward to seeing you again next week. And like I said, if you have any particular topics, I have a bunch already. A lot of people have sent me messages about the name of my YouTube channel is Edith Declan, EDITHDECLAN. Yeah, it's just my first and last name. It's very easy. So you can always go there. Yes, that's right, Nicole. Yeah, you can always go there and find all the topics that I had talked about in the past. Thank you so much, Ogoma, for joining. I know you came a little late, but I'm so glad to see you. Thank you, Anthony. Thank you all so much. And on this note, I'm trying as much as possible to keep the videos very short. I hope that someday I'm going to be having, guest speakers. I'm going to be having people share, this production with me, and I will be very glad. to have you all watching. Thank you again, and until then, do have a wonderful, prosperous new week. Bye bye.